So we've been talking a lot about cancer this afternoon, from breakthroughs in detecting it to the importance of screening. Another major part of the disease is fighting it. And to do that, many people turn to chemotherapy. As a matter of fact, more than 600,000 people who have cancer are expected to receive chemotherapy just this year. And while a few of the chemo side effects are common, hair loss, nausea, tiredness, there's another that often goes unnoticed, and it's called neutropenia. Joining us today to tell us more about it are Pamela Bryant, who is a breast cancer survivor and health communications specialist with the Centers for Disease Control and Prevention, and Dr. Richardson, who is medical officer and oncologist with the CDC. Ladies, thank you so much for joining us today.
Thank you.
So, Pamela, tell me about your cancer journey.
Yes, my breast cancer journey started about a year ago. I was diagnosed with early stage breast cancer, and my treatment plan consisted of chemotherapy, followed by surgery, and then radiation.
So you developed neutropenia. Explain that to me. What is that?
Well, neutropenia, as I understood, is a period after chemotherapy in which your white blood cell count is its lowest. And so for me, I did experience some points of neutropenia during my treatment. In fact, I was taking chemotherapy for about 4 months. So I would have a down week, and then I would have a good week. But during that down week, I was very mindful to check my temperature, to make sure that I wasn't running a fever, because had I run a fever, I would have needed to call my doctor right away.
So what was it that tipped you off? I got a problem here.
Well, again, just feeling not my best, kind of run down, feeling fatigued, you know, but fortunately I didn't have any major infections following my chemotherapy treatment.
Wow. Pamela, thank you so much. Dr. Richardson, let me ask you, why is neutropenia considered such a serious side effect of chemo?
Well, the neutropenia is a low white blood cell count. And during that time, patients are really susceptible to infections and can become overwhelmed with the infection, even leading to death. Right. So it's a very serious side effect. And as you said earlier, it's not seen, or, you don't know that you have it unless your doctor checks your blood, you have a fever, you come in, and we find out that something is wrong.
So if it's one of these things that's going to sneak up on you like this, is there anything we can look for to know that maybe we've got an infection?
Well, what Pam talked about earlier is exactly what we advise patients to do during the time when it is the lowest, which is about 7 to 12 days after the dose of chemotherapy is given, to take your temperature twice a day or 3 times a day. And also, if you don't feel well, to take your temperature, and if you have any symptoms that concern you, to call your doctor right away.
Okay, well, flu season is obviously such a hot topic right now. Is there something that cancer patients can do to help prevent some kind of infection?
Yeah, during this time period, we recommend flu shots for cancer patients as well, even those receiving treatment. It does work, and it does prevent the flu. And people who have a lowered immune system are actually more susceptible to complications of the flu. So we highly recommend the flu shot. And secondarily, or primarily, they can wash their hands whenever they think about it, and have others do that as well.
Okay, Dr. Richardson, thank you. Pamela, thank you for sharing your story. Before I let you go, let me ask you real quick. I guess dealing with something like this, it's really important to have the support of your family and friends.
Yes, most definitely. I was very fortunate to have such a strong support system from my family and friends, and even my coworkers. Everyone was educated on what was happening to me during this time, and so they all wanted to know what could they do to help. And as Dr. Richardson mentioned, the number one thing to keep us all healthy, in which we all practice, was good hand hygiene.
Big thing right there. Pamela, Dr. Richardson, thank you so much for your time this afternoon. Appreciate talking to you. Now, if you'd like to read more about what Dr. Richardson and Pamela just had to say, all you have to do is go to WBOC.com and click on the picture at the top of the page. Another problem that people are fighting, hunger. Up next on Delmarva Life, you're going to see how one group is working to end hunger in all children worldwide. And there's a great need on Delmarva, too. We're going to learn about various programs in place to help feed hungry families and how you can help. Delmarva Life will be right back.